Here's some notes on autonomic dysreflexia. This is a potentially life-threatening condition that can occur in anyone with a spinal cord injury at or above the mid-thoracic level, T5 to T7. The pathophysiology is autonomic nervous system overreaction. You can have unopposed parasympathetic signals because the spinal cord injury can cause decreased sympathetic outflow. At the same time, you can have an exaggerated reaction to sympathetic triggers. Because the nervous system is very plastic, you end up building receptors to these sympathetic triggers, and you become overly sensitive to any kind of sympathetic triggers below the spinal cord injury. So that includes bladder distension, bowel impaction, pressure ulcers, fractures, and other noxious stimuli below that spinal cord injury. So you can have parasympathetic and sympathetic symptoms. Among these symptoms, sudden severe rise in blood pressure, headache, flushing, sweating, chills, blurred vision, nasal congestion, anxiety, bradycardia. The treatment for autonomic dysreflexia is to identify and remove the noxious stimuli. Oftentimes it's below the spinal cord injury, as we discussed. You also want to remove tight-fitting garments because that can trigger you as well. If you elevate the head of the bed, you are orthostatically lowering blood pressure, and that's one way to manage the hypertension. You also want to monitor blood pressure and administer antihypertensive medications as needed.